Hi everyone. Today is my pleasure to introduce Wongu University of Oriental Medicine to all of you here. Wongu University is located in Las Vegas, Nevada, which is a beautiful city in the desert. Wongu University of Oriental Medicine vision is effectively prevent and treat chronic disease and promote whole person care globally. Our mission is to educate students to become skilled Oriental medicine practitioners who possess compassion and integrity. Wongu University of Oriental Medicine and its master level program in Oriental Medicine are accredited by ACCREDITATION. Wongu University is licensed to operate in the state of Nevada by the Nevada Commission on Post-Secondary Education. Our MSOM program is certified by the U.S. Department of Education to participate in the Title IV Federal Student Aid Program. Wongu University is a SEVP certified school under the U.S. Department of Homeland Security, which means we can issue the I-20 to the international student. We can assist the student with the F1 visa to transfer in or out our university. We have been approved by the Nevada State Board of Oriental Medicine to offer the MSOM program. At this moment, Wongu University is the only Oriental Medicine school in Nevada. At this moment, again, I think you may want to know the requirement of admission for our university. This is the photo of the student on the orientation day. The general admission, a four-year bachelor degree from an institution accredited by agency recognized by the U.S. Secretary of Education. The student needs to have the GPA of 2.75 or above. If you are the international students, you have to have the credential that is equivalent to the U.S. trained applicant. You also need to have the English competency, which you can choose between TOEFL or IELTS. If you choose to do the TOEFL IBT, you need to have it above 61. And if you choose to do the IELTS, you have to have above level 6. Level 6 or above. Cost of an MSOM program at Wongu University for the tuition is $63,000. One-time application fee, non-refundable, is $100. The book, this is just estimate, is about $1,500. You can spend more if you want to on the book. Each term, you will have the registration fee, student association fee, supply, and if you are in the clinic, you will have the malpractice insurance. The MSOM program didactic is meet the requirement for the NCCOM examinations requirement. Our MSOM program is 2,500 hours. This is the atmosphere of the classroom at our school. We also have the hand-on class and also the library. Small but beautiful. We have books in English, Korean, and Chinese for the Oriental medicines. We also have the textbook of Western medicines. About 2.5 years, you will begin the clinic. In the clinic, you will apply your information, your knowledge that you learn from the classroom with your patients. You will have opportunities to go out to the communities for the outreach program. You meet the local, you meet people outside. You talk about Oriental medicines, acupunctures, herbs. In the clinic, you practice the things that you learn from the classroom, acupunctures, moxa, cupping, gua sha, pulse diagnosis, tongue diagnosis, as well as herbal preparation. At the end, you will have the opportunity to go for the foreign country, treat the patient in the university hospital. 2 years ago, we went to China, and last year we went to Thailand. After you finish 2,500 didactic hours and 1,000 clinic hours, then you will be graduate. Soon after our students graduate, they usually take the NCCRM licensing exam. For the NCCRM requirement of the US graduate is the master's degree program in Oriental medicines, and that need to be offered 4 years education. Total hours will be 2,625 hours. That should be include 870 clinic hours. Also clinical technique certifications. If you are the international student graduate, you have to have the degree or diploma in Oriental medicines, traditional Chinese medicines, or acupuncture. You can find more information on the nccrm.org website or email us at wongu.edu. After you pass all 4 NCCRM licensing exam, if you plan to stay in Nevada, then you have to take the Nevada State Board of Oriental Medicine's licensing exam. The general requirement for the Nevada State Board of Oriental Medicine's licensing exam will be the bachelor's degree from an accredited college. And again, 4 years of study in the master's degree in Oriental medicines or the equivalent from the ACCREDITATION college accredited. Nevada State Board of Oriental Medicine has a little bit higher requirement. It's not like 2,625. This time is 3,000 hours for the total hours, which that need to be include 2,500 didactic hours. And again, NCCRM Oriental Medicine certifications, which I already talked about on the previous slide. If you have any questions about Wongu universities, please feel free to contact us. You can search the website wongu.edu or Wongu info@wongu.edu. Next, I would like to present a case. As you all know that in the Oriental Medicine universities, other than the didactic class, then you have a portion of the clinic. This patient has been with us for 2 years. She is female, 71 years old. She came in because of the post-West Nile virus. Previous medical history. In 2017, patient contracted West Nile virus. She has high fever, pneumonia, and later on she has a brain swelling. She was hospitalized in a coma state for 1 month. Her immune system was impaired, hair loss, weight loss for over 40 pounds. After she was in the hospital for a month, she was admitted to the rehabilitation centers and bedridden for almost a year. For the current medical history, she has an initial consultation with us in 2018. That time, patient is unable to walk. She has a pacemaker. She came in because of the complaint of the back pain. The back pain is characterized by the tightness and sharp pain, muscle spasm every hour, and is very frequent in the morning. She also has a numbness on the lower legs. The pain scale in the beginning is 10 out of 10 when it's spasm. It's about 3 out of 10 when she rests. The pain is aggravated by moving, getting up, falling down, and is alleviated by heat. The first time we treating her with some acupuncture. Anyway, let's talk about the head, she has an occipital moving headache. Red eyes, dry, itchy, no complaint anything on the ears, congestion, and then dry throat. She urinates about 4 times per day, 1 time per night. Normal bowel movement with 2 times per day. Thirst, she decided to drink in a small sip. Appetite is normal. She has flatulent bloating. She sleeps at 7 o'clock, wake up at about 2 times per night. She has some depressive disorder at that time. She also has lung cysts, gallstone, kidney stones. The tongue is enlarged, red, dry, thin coat. The pulse on the left side is sleepy and weak. Shoe position is deep. The right side sleepy, slightly wiry. Shoe position is also deep. At that time, the diagnosis is kidney and spleen qi deficiency with the liver qi stagnation with heat. The treatment principle is tonify kidney and spleen, regulate liver qi, and clear heat. We use UB 13, 17, 18, 20, 23, and 52. Do 4 kidney 3, GB 21, and LI 11 for acupuncture point. She's getting the treatment for 2 years, and then we have the follow-up treatment in August 2020. Again, same thing, back pain. Characterized by tightness only, no sharp pain. Alleviated by heat, relax, laying down. And the pain scale is 4 out of 10, no more spasm, no more 10 of 10. Her vision was decreased, itchy, dry, and ear is clogged, nasal congested with a thick yellow mucus. Appetite is normal. Thirst, she preferred to drink the room temperature drink. Now she can walk. She exercises 4 times a week. She walks. She sleeps better and stays asleep longer. Also, she still has the lung cyst, gallstone, and kidney stone. The tongue is enlarged, red, less cold, engorgement. The pulse on the left side is moderate, slightly rapid. The right side is sleepy, and the shoe position is weak. The recent diagnosis is local qi blood stagnation, lung and spleen qi, kidney yin deficiency. We tonify the lung and spleen qi, knowledge kidney yin, regulate qi and blood. And we use acupuncture point on GB 2021, UB 1020, 40, Do 4, Do 14, kidney 6, spleen 6, SI 11, Yao Yan, Su Xi Zhou Zui, Hoto Jeji, recupping and do the tweener on her back. The patient has been treated by multiple WSC supervisor and clinic interns since 2018. She feels a lot better, and up until now, she still comes and gets acupuncture treatment regularly to maintain her health.